Okay, my name's Ian Adcock and I work at the Imperial College London, UK, and I was one of the 5 originators of the original U-BIOPRED project, and I run work package 6, which is the in vivo and ex vivo models of asthma. If I was to explain to an aged relative what U-BIOPRED aimed to do, it would be to really collect together and understand how different patients with severe asthma are similar but also different, and how we can produce models of their patient characteristics that will enable better drug discovery so we can obtain drugs for each individual patient. The area which I'm working on at the moment is really to lead the in vivo and ex vivo models of severe asthma. And one of the things we did first of all was to examine which models were available to test drugs in, and how they mixed or matched clinical phenotypes. And we found that none of the models that were used by industry or by academics matched initially. So we've devised or designed new animal models that mimic certain aspects of the human disease, such as relative steroid insensitivity. And are developing that. We're also taking cells from patients with disease and deep phenotyping those cells so that we can produce biomarkers that could map to the patient samples that we obtain. What's new or unique about the program is really the working with industry partners to assess whether or not current models were of benefit to developing new drugs for severe asthma. On assessing those and re-evaluating them, we found that the models weren't sufficient for drug development, and we've produced new models. And I think that's probably the highlight of our work to date. In the last phase of the project, we will be publishing data showing how our new animal model of severe asthma maps to particular subgroups of patients with severe asthma. We'll also be taking other models of disease and mapping those onto particular phenotypes or clusters of phenotypes that we see in the patient cohorts. I think the findings of U-BIOPRED are significant for a number of reasons. First of all, it's the approach to understanding that asthma, particularly severe asthma, is a complex multitude of diseases, not one disease, and to try and understand biomarkers that could predict which patient had which type of severe asthma, and also develop models that will enable us to test drugs in the models that are predictive of patients who might respond. I think the key outputs we will get that will enable us to affect the lives of patients with severe asthma are the knowledge that we understand far more about their disease. B, we'll be able to obtain biomarkers that may be able to determine what type of severe asthma they have. And C, in the short to medium term, we will be able to recruit those subjects for personalised trials that would be testing medicines that would be of benefit to them rather than other patients.